So I'm Dan Flaming. I'm president of the Economic Roundtable. We're a public benefit research organization. We spun off from Los Angeles County in 1991, and one of the areas of research that we focus on is homelessness. I worked for Los Angeles County for about 21 years. I directed HUD housing programs and also job training programs, and had created this research unit in the county. Our cost study in Los Angeles began as a very modest study to look at a program that had given intensive help to about 50 people. Sometimes it's about the same amount of work to do a big study as a little study because the problem is getting hold of the data. We expanded our cost study in Los Angeles to include everybody we could identify, about 9,000 homeless people who represented our homeless population well, and another 1,000 people who'd been housed. And when we looked at the cost distribution among folks who'd been homeless, we found this hockey stick pattern with most people not having very much cost, and then a small number, 10%, accounting for most public costs, over half of public costs for homelessness. So there was a lot of interest in, who are these people? How do you find them? And so then we developed a screening tool, a triage tool for identifying these people. We did that in Los Angeles. We did a couple more variations on the tool, and we launched a pilot program to use the tools in hospitals and to house these very expensive people directly out of hospitals. Santa Clara County is interested in bringing it to scale, so they are doing record linkages, which gives you the data for finding these folks. These are the most complex cost studies that have been done, the most complete, the Los Angeles and Santa Clara County. Other regions like New York, Philadelphia, Denver have done much simpler studies and not been able to break out costs in as much detail. So the cost studies here in Los Angeles and Santa Clara show costs by public agency and savings after people are housed by public agencies. The Santa Clara data is really by far the best data about costs of homelessness because it's a much larger group of people. It's 104,000 versus about 9,000 in Los Angeles. Linked records are the key tool that we use for screening and for identifying these high-need, high-cost people. When we link public records, we see a lot of dimensions of people's lives over time. So we see all of their health system encounters, all of their medical diagnoses, their stints in jail, their use of public assistance, their episodes of homelessness. We have information that lets us know both about people's problems, their attributes, their age, their gender, as well as their system use. And that then we can use to target people for intervention. But one place to start might be the public social services system. So that is going to take in most of the population in poverty, and then you can potentially expand that list of people with your HMIS records from your continuum of care. You want to start by identifying everybody who's been homeless. So you'll find most of the population in those two agencies. You can also identify additional people out of different elements of the health services system. It depends on record keeping in the county. But in Santa Clara, we started by creating a spine of everybody who'd been homeless. And then we attached records from every agency to that spine. We want health diagnoses. We want all encounters with any kind of health care, whether it's a hospital, a clinic, a psychiatric emergency service, emergency medical transportation. We want justice system information, time in jail, kind of incarceration facility, security classification, arrest data, charges. We want the homeless management information system data about homeless stints. We want the public social service data, which tells us quite a bit. Anything we can get about their housing is very valuable, particularly if we can get post-homeless data for people who've been housed to compare costs. Um, Agencies have to give up their crown jewels, which is their data. They have to agree to share it. And so there's a policy issue to get people to agree to do that. It took a lot of effort on the part of Santa Clara County, so staff there spent quite a bit of time on it. It does take a champion at the top to get that to happen. It takes the county board of supervisors, the county executive office, to make people drop something else they're doing and do this. So it does take staff time, which costs money, and it also takes experts to analyze the data and develop tools out of it. Executing a good linkage is also hard. For the 104,000 people in Santa Clara County, we were working with 25 million linked records. So different agencies use different kinds of identifiers. People show up with different variants of their name in an agency file. Deduplicating records to get it, the individuals, and then to link them across agencies is a technical challenge. It's doable, but it's not trivial. You need champions at the top to get this to happen, and then you need a set of technical skills for doing the linkages to do it well. But once you do that, you have an extraordinarily powerful tool. And you can use it both to describe need, you can identify outcomes, and you can use it to develop tools for targeting interventions on high-need people. What we're doing is focusing on these most expensive high-need people. What we found was that average costs were about $60,000 a person when people were homeless, and they go up above $1 million a person. So there are some people with very, very high costs. When people are housed, if you take service costs of about 20 or so thousand a year, and the housing and the services while they're in housing of about 17,000, you have savings of about 19,000, 20,000 a year per person. The solution is cheaper than the problem. For these very high need people, it's cheaper to house them than to leave them homeless. These high cost 10% are in a sense the financial low-hanging fruit because they're so expensive. We save money when we house them. That it's an absolutely good solution because these are the most visible and most distressed people out on the streets. It does reach the people with the most acute needs, and it also makes a community more livable by giving folks who are in distress on the sidewalk a place to live. One of the very interesting things in Santa Clara data is it's longitudinal. We have 6 years. Most people make it out of homelessness pretty quickly under their own steam. Over half make it out in less than a half a year. So if we can increase those rates of early exits, then the pipeline toward chronic homelessness shrinks. So things that we need earlier and that we need tools for targeting are reemployment, targeting people for temporary subsidized housing till they get on their feet. Pragmatism is compelling and cost-saving arguments are compelling. So we have a segment of folks who experience homelessness who, through a cost study, we discover they have recurrent crises. They're in emergency rooms a lot, they're in hospital beds a lot, they're sometimes in jail and in mental health confinement, which is very expensive. We can see very pragmatically that the problem that we're leaving unaddressed is costing us a great deal, and that in fact the solution saves us money. So the cost study is very compelling for documenting that this problem exists, it costs a great deal, and we can actually make people's lives better and save money. Doing a cost study has two benefits. One is it tells you the exact nature of the problem in your community. Who are the people who are frequent users of public services? What kind of services do they use? What are their costs? It also provides you with the information you need to develop targeting tools and also to then apply those tools to be able to flag people so that when they come into a public assistance office or a hospital emergency room, you can have a flag in their record that says they're eligible for housing. Yes, it's very likely to produce a similar story to Los Angeles or Santa Clara County, but maybe people need to hear it about San Diego specifically and not about another place. It's a strategic decision about how you drive change and the information you need in a community to drive change. The triage tool is predicting who is going to have continuing high costs in the future. A lot of times people have just one-time cost spikes. So the tool is trying to separate that from people who have continuing high levels of need. And the tool gives people a probability of 0 to 1, 0% to 100% of being in this high cost group. With the tool assigning these probabilities, you can prioritize people. If you have 3,000 people who you've identified as homeless, but 200 housing units, you can give top priority for the housing units to these first 200. So it's a tool both for targeting and for prioritizing. The tool is available free off our website, so the tool's out there for anybody to use. It takes linked administrative data to drive it. In particular, it takes health data for the past 2 years, and it takes jail data for the past 2 years. That the problems of poverty and the cost to the public as people's level of distress gets more extreme, that in a lot of communities there really is a drive to change this. And to do that, you need more effective outcomes from the services being provided. That really means you need to integrate services. A record linkage is what underlies a cost study, and a record linkage is a tool for a county to understand service delivery and to integrate it and coordinate it. Well, one of the things it reveals is patterns of service use. So often multiple agencies are touching the lives of the same person and they don't know it. So mental health services, medical clinics, hospitals, homeless service providers may all put the public assistance system in the jail and sheriff system, the probation department, substance abuse treatment may all be touching a person's life and they're not coordinating their services. So it can be a tool for service integration and more effective service. It can also show services people need and they're not getting. So, for example, substance abuse is prevalent. Providing behavioral health services to help people reduce the level of harm they do to themselves through substance abuse, that can also be targeted with this kind of data. So one of the things a study like this can support is thinking more broadly of what kind of solutions do we need to bring down total costs, and housing becomes part of that solution. I mean, one of the things that's happened in Los Angeles County is that the healthcare system has also become a housing provider. So our healthcare system is using some of its dollars to lease housing and put high-need patients into that housing, homeless patients. A challenge with a study like this is making the dollars fungible. So you identify the high-need people and you house them, and so they're using the jail less, they're using the hospital less. But how then do you move those savings to pay for housing? And I think one of the things that's starting to happen is healthcare providers are starting to see that housing is a piece of a solution for health, and also people coming out of jail with histories of substance abuse and self-medication, with mental health problems, that part of that community reentry solution is for them to have housing. And so some of the dollars from the state for the movement of people out of prisons to jails and out of jails into the community need to be spent for housing. It's a tool for thinking about solutions more broadly. That really for that person to be healthy and out of the hospital, they need a place to live. I think one of the things Santa Clara has done pretty well is create a center of gravity for caring about it. The Destination Home Jennifer's group pulls together foundations, the county, the housing authority, the nonprofit providers. They've become a powerful point of consensus, and they represent a lot of leadership from the county. So I think finding a way to create a powerful voice for people who care about homelessness, and that change is possible. It's a problem we can make headway on. The reason Santa Clara has brought a group of the real powerful leaders in the community together, and it has a lot of clout. Part of people not having clout is they're fragmented. So to find the people who care about this and are in significant positions, city council, board of supervisors, whatever. I think in Santa Clara, the dynamics were the top leadership had decided they wanted a campaign, and this was a tool that gave them ammunition for the campaign. So I think the leadership was already kind of behind it, but they wanted the ability to have a very strong argument. One is I think there's a really strong set of champions in Santa Clara County, so there's maybe more public unity around the issue. Santa Clara County had also deferred acting on this problem for a long time, so their inventory of permanent supportive housing is very small, and it's an extremely expensive area in which to find housing. I think folks felt it was a problem they couldn't put off addressing any longer. Here in Los Angeles, our Continuum of Care is a weak organization. It's a joint powers of the city and the county, but on its own, it doesn't have much clout. Its board is appointed by the mayor's office from the city and by the county board of supervisors, but they have a comparatively small budget. So the HUD money for homelessness is very, very small compared to, say, public social services or healthcare. It's just here politically not very strong. Los Angeles has been developing modest amounts of permanent supportive housing over a long period. We're still far, far short of what we need, but we had made a bit more progress than Santa Clara in building up a small inventory. With their bond issue, Santa Clara is really getting its arms around this problem. So if that's approved, that'll be a very powerful force. There's one in Los Angeles City for building housing, which is just a little larger than Santa Clara County. So for a much bigger city, a smaller, comparatively smaller bond, but there is. It's something that we love to do. Yeah, yeah. It's something we like to do. Yeah.